I follow a nurse around early on in my research because I was learning how to best follow a nurse and observe them. And I'm following a nurse around at a hospital, and she's got 4 to 5 patients. She had had an admission earlier in the day. And all of a sudden, I noticed this busy RN on this busy unit looking about in some closets, and I was wondering what she was looking for because I don't interrupt their work by asking them questions during it. And she pulls out a commode, a portable commode, from a room where a patient had just been discharged. She goes and gets a spray bottle of cleaner and a towel, and here the RN is in the middle of the hall of the unit cleaning the commode. Now, I happen to know that in that hospital, within the past year, there had been a lot of money spent on teaching RNs delegation skills so that they would no longer find themselves doing work that somebody else could do. So I'm thinking, wow, what if the nurse administrator who has spent all the money comes up and sees the RN cleaning the commode in the middle of the hall? Because that's what they would see, right? And our normal, usual reaction in the past would have been, why are you doing this? You know, you have nurses' aides or techs or other people. You know, isn't this something that somebody else could have done? And if we would have asked it in the way some of us have asked it in the past or whatever, there wouldn't have been much explanation. Maybe, I had to do it, or I was the only one available. So when I interview this RN after my observations, that's what I was going to hone in on. I need to know your thinking around cleaning the commode in the middle of the hall right at that point. Because I had already been convinced that complex adaptive system theory and human factors is all part of it, not that the person just loves to clean commodes in the middle of the hall. So I asked her, I said, talk to me about what you were thinking when you did that. What was influencing your decision? And the RN says to me, and so this is all invisible until we go to ask. And something that nurses, they couldn't possibly reveal all their thinking like this throughout the day because it's constantly occurring. She goes, well, I had admitted the little guy who was in his 80s first thing this morning, and they brought him up in a wheelchair from one of the outpatient clinics. And one thing I noticed was when I helped him from the wheelchair into the bed, he was a little unsteady on his feet. So I helped him into the bed, I got him all settled, I asked him, if he needed anything, did he need him to go to the bathroom? He goes, no, maybe in a little bit though, check me in a little bit. And so puts him in the bed, goes about taking care of the other 3 to 4 patients, went back, did a little bit of admission assessment on the guy. He seemed comfortable, but said that, he might be needing to use the bathroom soon. Goes out, helps some other patients. But she said, all of a sudden, I remembered, I've got to get in there and either help him to the bathroom or get him a commode, because if I don't, and this is how all the thinking relates not only to the patient, but to the flow of work and organizing work. If I don't, he's going to get up on his own. He's unsteady on his feet. I picked that up when I transferred him to the chair. He's going to fall. He's older, he could break a hip or something, not what he intended when he came in here. I'm going to have to spend time making out an incident report, which is going to take time and be something else I have to add to my stack. And it's just a bad situation all around. Right now, I'm going to go get that commode and put it in there so I can check that off my list and not have to be thinking about that. So she looks around, her tech is tied up doing a complete bath on one of her other patients in her room, and there's no one else available, so she decides to clean the commode at that time and get it in there. To me, that was so rich in terms of assessment, the cues this RN had picked up, her understanding of her workflow, and where she had reached the limit beyond which she wasn't safe going without risking that patient's injury or increasing her workload, not finding an available substitute, decided to do that then.